Hello, my name is Sydney Walden, and I'm going to begin my presentation by sharing a current news story. The news story I'm going to begin discussing is by ABC News, and it is titled, "One Nation Overdosed." According to this news story, the Center for Disease Control reports that overdose deaths involving prescription opioids have quadrupled since 1999. And drug overdoses now kill more people every day than gun violence or car accidents combined. One American now dies every 11 minutes, and more than 2 million Americans are now addicted to prescription painkillers. In 2015 alone, more than 33,000 Americans died from opioid overdoses. This story gets closer to home when it goes on to talk about a 22-year-old from Louisville, Kentucky. Veronica had been struggling with drug addiction for years, and this past summer her family felt she was finally trying to get her life on track. She'd been in and out of rehab trying to get clean for her 4-year-old daughter. A study published by the Journal of Substance Abuse Treatment found that patients with opioid use disorders who have gone through short-term inpatient treatment have a 70% relapse rate without the help of maintenance treatment, meaning without access to naltrexone. This is a drug that blocks the opioid effects. With naltrexone, the study found that the relapse rate decreased to 31%. On Friday, July 14th, Veronica checked herself out of rehab to spend the night with friends. The following morning, her mother got an awful call. It was a call saying she needed to get to the hospital as soon as possible. It had to do with Veronica. By the time her mother arrived, Veronica had already passed away due to an opioid overdose. This death was tragic and preventable. In an instant, there was a grieving mother who had lost her child, and a 4-year-old who no longer had a mother. The opioid crisis affects the nation due to the violence and death that it brings. Many of these people who overdose end up on the unit that I work on. They are in excruciating pain, yet nothing we can give them helps alleviate their pain because of the high tolerance they've built up to opioids. This also affects my nursing profession because since the opioid addiction is on the rise, many providers are hesitant about prescribing opioids to patients because they are afraid these patients are drug seeking. And this harms those patients who are truly in pain who don't have the intention of abusing their opioids. As nurses, I feel like it is our obligation to educate patients not only on the pharmacological pain management strategies we can offer, but the non-pharmacological pain management strategies we can offer, such as massage therapy, aromatherapy, music therapy, and many more, all of which can help decrease the amount of pain medications a patient perceives they need during their hospital stay. I also think it is very important that when we give patients prescription pain medication, especially for them to take home, that we educate them on the dosage and how important it is to take them as prescribed so that we can prevent accidental overdoses. The non-pharmacological pain management strategy that I chose is music therapy. I chose music therapy because I feel like the patients are not educated enough on the availability and benefits of music therapy in the unit that I work on. Music therapy is essentially a healing mechanism used by accredited music therapists. By skillfully using music, individuals can promote, restore, and maintain all aspects of their health. This includes physical, emotional, psychological, and even spiritual health. Research shows that music therapy can be an effective pain reliever, and it's been associated with improved quality of life and reduced consumption of pain medications. Music therapy reduces the amount of perceived pain, promotes relaxation, alleviates anxiety and stress, and increases mood. The music therapy in the hospital that I work on, they have a protocol and it is designed to perform several functions. The first function is to direct attention away from pain or anxiety, distracting the listener with comforting music. The second function is to provide a musical stimulus for rhythmic breathing. The next function is to offer a rhythmic structure for systematic release of body tension. The next function is to cue positive visual imagery and to condition a deep relaxation response. The next function is to improve mood and to focus on positive thoughts and feelings and to help the patient celebrate their life. Music therapy is based on the improvisation of music by a therapist and a patient. Sometimes it is done one-on-one, but other times it is done in a group setting. There are two main branches of music therapy. There is active music therapy and passive music therapy. Active music therapy involves interaction between the therapist and the patient, much more than passive music therapy, in which the patient is usually at rest but listening to the therapist. With passive music therapy, the music therapist plays calming music and invites the patient to visualize peaceful images. And in active music therapy, the therapist and the patient both work together using their instruments and voice. The title of my presentation is The Use of Music Therapy to Decrease Patient Pain and Anxiety. The target audience for this presentation will be patients that are 18 and older and their families. The patients will be given this information so that they can use it to help better their care. These patients are being treated in the ICU setting. Most of these patients suffer from chronic and acute pain, and pharmacological pain management is simply not enough. These patients are looking for non-pharmacological pain management therapies to help them relax and alleviate pain, so that they don't have to keep going up on their doses of pain medication. So what are the goals of this teaching plan? At the end of this presentation, the patient and their family will be educated on the benefits of music therapy and will potentially ask for music therapy during their stay. There are 3 types of learning objectives. There are cognitive, affective, and psychomotor that I will be presenting on. The first cognitive learning objective is that the patient and their family will be able to repeat 2 benefits of music therapy. The second is that the patient will be able to synthesize all the information presented about music therapy and evaluate if it is a good option for them during their hospital stay. The next learning objective is an affective learning objective. It is that the patient will ask questions about music therapy and really participate in their learning. The next affective learning objective would be that the patients will verbalize that they found value in what they learned about music therapy. The next learning objectives are psychomotor. The first psychomotor learning objective would be that the patient will ask their healthcare provider to set up a visit for music therapy during their stay. The second psychomotor learning objective would be that the patient will provide the healthcare providers with information on the types of music they enjoy and find relaxing and would potentially like for the music therapist to play for them. Cognitive learning will have occurred if the patient and their families can repeat 2 benefits of music therapy back to the nurse and can make the judgment on if music therapy is right for them. Affective learning will have occurred if the patient and their family ask questions about music therapy and verbalize that they found value in what they learned about music therapy. Psychomotor learning will have occurred if the patient and their family ask for a visit for music therapy and provide the healthcare team with information on the types of music they enjoy. I'm now going to go over my patient handout. We'll start with a fun fact. Research shows that music therapy is an effective pain reliever, and it has been associated with improving quality of life and reducing the consumption of pain relievers. What are the benefits of music therapy? It reduces the amount of pain perceived, promotes relaxation, alleviates anxiety and stress, and increases the patient's mood. What types of music therapy can reduce many types of pain, such as post-op pain, cancer pain, anxiety, and migraines. For more information, you can visit Everyday Health and Psychology Today. So now we can take a closer look. I believe music therapy can be very beneficial for patients. It is something that is easy for the nurse to bring into the patient's room. It can help a patient relax, and I really feel like it can help decrease the opioid epidemic. If patients were aware of all the non-pharmacological pain interventions that were available, I believe that they would request pain management, pharmacological pain management strategies less. Thank you for your time.